Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, Chief Medical Officer of Good Samaritan Physician Network. As with me as usual, Adam Thacker is our Chief Operating Officer. We're going to be giving you a rundown on where we're at with COVID in our community, a little bit of happenings over the course of the past week or so. We've had some exciting things happening, update on our numbers, testing, and then kind of where we think things are going to be headed over the course of the next few weeks or so. So far, roughly about 2,700 positives that we've had since the beginning, a little bit over 320 active cases that we've got going right now, but the numbers we always come back to are the positivity rate, around 13% and 32% for the unique individuals, and really those unique individual positivity rates, that's one of the things that we watch more closely as driving how things are going, as well as what the active number of patients are we have in our community.
Right, and we've been reporting above 30%, I think, for a number of weeks now. So what that tells us is that's a continued, sustained transmission within our community. Certainly, we kind of expected that during this time of year and this season, but as we're here on the week of Christmas, it puts extra emphasis on being thoughtful about what those interactions are with your family and the best way to still celebrate Christmas. It's going to be a little bit different this year, and we expect that people are going to make those plans and take every precaution to have a safe Christmas. We don't want your Christmas activities to lead you to visiting a loved one in the hospital, and unfortunately we have seen that around holidays since March. As holidays have came up, we have seen those increased number of hospitalizations that have led to after that.
And certainly we saw a big surge in the ambulatory world after Thanksgiving. Just as you said, after every holiday we've seen that. Fortunately, we didn't see as bad outcomes as far as really sick people being admitted to the hospital, and part of that probably has to do with the fact that we started doing the monoclonal antibody infusion about 3 or 4 weeks ago, which has gone very well. This is somewhat of a bridge to get us through until we have enough people vaccinated. We've been utilizing that monoclonal antibody, the Regeneron product, and then the bamlanivimab for the past 3 or 4 weeks, given over 120 doses or so of that so far. And really the place that we've been using that is in the ambulatory world and the people that we are the most concerned about who have more risk factors for the illness.
Right. That's been a wonderful addition to our response to COVID, is having an outpatient therapy that has really proved to be very effective in keeping patients that otherwise we know about 20, even 30% of that population would have progressed to needing hospitalized care. And to date, out of those 121, we've had one that required hospitalization due to COVID.
Yep.
And so that's been tremendous, because that takes a burden off of our inpatient resources that have been stressed and strained to the max at times, and even when not to the max has always for the last 9 months been very stressed. So as testing leads to being able to identify appropriate patients for that treatment, if you're symptomatic, if you're in the high-risk categories, definitely getting tested sooner rather than later is important, because as we've spoke about in the past, there's a window of time that treatment is appropriate and can be utilized versus when we're outside of that window and unfortunately we can't utilize that treatment.
Absolutely, and as Adam is saying, really the first 7 days of the illness, when you become symptomatic, the earlier we can administer that antibody in that period of time, the better. People who are over age 65, people who have chronic medical problems, obesity, body mass index above 35, diabetes, chronic kidney disease, chronic lung disease, these are all some of the risk factors that we look at. And actually people of any age who have some of those chronic disease factors we want to know about. So whereas if you rewound a few months back where we told people, hey, we really want you to stay at home and convalesce, let us know if you're getting sicker. If you happen to be in one of those higher risk groups, if you happen to be over age 65 or have any of those chronic medical conditions, we want to know about it as quickly as possible. Get in touch with your primary care doctors, get in with convenient care, get tested. We have the rapid test we've now been utilizing for quite some time, and within 15 minutes we have a result of that, and then we can get that infusion for you typically the same day or the next day. And we have seen tremendous turnarounds just within the first 48 hours or so after that's been administered. So please get in touch quickly.
And I think the other element, anytime we talk about administering an infusion or a drug, there's always the question of, well, what are the side effects? And thankfully with this, we've seen great results from a clinical efficacy standpoint, but also the side effects have been little to none. For an infusion, it's infused over an hour, and patients have done extremely well with it.
Yeah, essentially this is a targeted treatment for COVID-19 where basically they have looked at what antibody will effectively kill the virus. And the reason it's so important to be administered early in the disease process is before that virus has time to replicate and cause systemic inflammation, we're targeting it with this antibody and getting it treated early on. So again, report symptoms early, get tested, get results quickly, and get the antibody infusion as quickly as possible. And then basically the thought process behind this is this has kind of been a bridge that's getting us to a point when enough people have been vaccinated. And that brings us to the most exciting thing of the last week, which is basically vaccine administration has begun. And I know that you were the logistics official during this process, so tell us a little bit about what started and kind of where we go from here.
Sure. Well, absolutely. So this Facebook Live is one I've looked forward to for a number of our events to be able to talk about. We are giving COVID vaccine. Started last Thursday. We got our first shipment of just about 1,000 doses on Thursday at noon, and by 4 o'clock we were administering vaccine. 42 vaccinations were given on the first day, really just to work through that logistics, our workflow, make sure everything was in order and ready to go. And then on Friday, over 200, on Saturday, over 100. So we're over at 350 healthcare workers have been vaccinated, running 6 days a week. So here in about 20 minutes, our vaccine clinic will open up again, and we will start going, giving more vaccinations. And our schedules are filling up. As of on Thursday, when I looked at it, we had over 650 appointments signed up, and that's just continued to fill up. I'm sure we're well over 800, maybe even closing in on 1,000. So it's really exciting. And similar to I mentioned with the monoclonal antibody, seeing little side effects. I mean, that's the big question with this vaccine. Was it rushed? Is it going to cause side effects? What are all of those implications? And we have seen the typical reports of side effects of just my arm hurts, so muscle pain at the site injection, a little bit of tiredness. A few have reported had a very slight low-grade fever, nothing of real significance, and so that's equally exciting that we're seeing those types of results. Again, this is a 2-shot regimen, so in 21 days for Pfizer, and now the Moderna vaccine has been approved on Friday, which that was also a very welcome addition to our fight against COVID, to have a second vaccine that's now approved. It's a 28-day spread between the 2 shots. So going very well. The operations of the clinic have flowed exceptionally well. And then CDC advisory panel reviewed what's next. So that becomes the question. What's next? How do we move into essential workers and community? And we learned that the advisory panel has sent to CDC that the recommendation is phase 1B will be essential frontline workers. Think police, fire, also anyone involved in transit, even in food produce, so farmers and those grocery stores, those populations are identified in that. Essential frontline teachers are identified, and then the age population, they're looking at 75 and older. And so the immediate question, and I got a question late last night, where's this leave that high-risk community that you've been talking about, we've been talking about, and that has already been kind of earmarked as 1C. What we don't know is the dates. Right. So that becomes the next question. When does 1B go live? When does 1C go live? Because there's a lot of people saying, I want to get the vaccine. When am I eligible? We'll communicate that as we get that information. I think it's important to make note that it's not a Good Samaritan triage process. We don't get to set who gets it, when they get it. We act off of what CDC is telling the nation, then our state calls tell us, okay, this is how we're implementing that, and then we say go.
And that process is rolling out quicker than we thought, honestly, as far as the approval process, what ACIP's review has been, and so forth. So we're excited to see that as that is progressing, this is all getting rolled out very quickly. The exciting thing about it is, as we march through each of these, every time we get through another group, it is safer for the entire population, and there are less people at risk and less transmission. And so, just as you said, one of the questions I get most commonly is, how will that work? Well, all that is occurring right now. Every day, those decisions are being made as to how the sign-up will work and the process is going to come out. And then the bigger question is, well, how long is it going to take till we reach a critical mass of people that have been vaccinated? And it's going to be months before that happens. But it's important to realize that some of our biggest concerns, which have been, are we going to be able to continue to deliver health care to patients as this is getting rolled out through the frontline workers, the first series of 1A, that is taking some of the load and concern off of our mind that we'll still be able to continue to care for all the patients that we need to take care of over the course of the next few months. So very exciting times. I received my vaccine this last Thursday, and I would equate it to less than a tetanus vaccine in terms of discomfort. Shot doesn't hurt. Next day you get a little bit of a sore arm and carry on from there. So
I'm signed up for January 8th. I've put myself back a little bit as I'm not on the front lines as you are. But I think it's also worth noting that social media certainly has its value in being able to communicate, and you've probably seen a lot of pictures of healthcare workers getting vaccinated and excitement around that. But you have probably also seen comments about microchips or tumors, or the many things that can be put on social media, obviously, because you can mix facts and opinions. I think it's important for us as the healthcare leaders to just really communicate to our community, get educated on the vaccine from reputable sites, whether that's the CDC, whether that is the manufacturer's own sites with Pfizer and Moderna. There is a host of reputable fact-based sites that you can use to educate yourself and then make a decision if getting vaccinated at what time you're eligible is right for you or it is not. There are certainly some situations where it may not be appropriate to get vaccinated right away, but the vast majority of the time it is appropriate that go ahead and get vaccinated. But make those decisions based off of facts, not off of really what would be more of scare tactics and misinformation.
Well, it's important to realize that this is one of the most effective vaccines that we administer nowadays. The safety of it really has gone well. They've studied thousands and thousands of patients, and really the only true contraindication is having had a previous severe reaction to any type of vaccine. As we kind of progress along and get more experience locally and regionally, we've seen very few reactions to anything other than what Adam described, which is basically typical vaccine site reaction. And yes, I've had a number of conversations with some of my highest risk patients who have come in saying, well, I'm worried about this vaccine. Well, if we look back in history in terms of flu vaccine efficacy and safety and shingles vaccine efficacy and safety, this is very safe. It is extremely efficacious. When we look at the numbers and statistics that back up this vaccine, it's tremendous. We rarely, if ever, see vaccines that are above 90% in terms of efficacy. So the fact that the risk reduction with it is so great is extremely encouraging. And again, as we continue to roll through the different groups that are going to be vaccinated, we all feel a little bit more at ease and a little more comfortable that we can continue to deliver services and our highest risk people get taken care of.
Right. I think that in healthcare we deal in risk benefits all the time, because when patients are taking medications, there's always a risk of you're taking a medication. It is by nature a produced chemical or an agent going into your body, so there's always a risk benefit of side effects versus benefit. But you also have to look at the risk benefit of coronavirus, the virus and contracting the virus and becoming ill versus the vaccine. And I feel like we can unequivocally say that the risk of getting vaccinated is much, much lower than the risk of the potential effects of having coronavirus.
Sure.
And that's the decision that it really comes down to.
And the other thing that's important is, again, we are trying to achieve herd immunity that will protect everybody, because there are some people that won't get the vaccine by their own choosing. There are people that won't get the vaccine because of potential problems they've had in the past with reactions. And so we want to reach a critical enough mass that we can assume that everybody else is going to be protected. So it's important that people buy into this. I've had some very interesting people come in and tell me all about the chipping and so forth. And my response to them is, if we had the ability to affordably put chips in everybody, we would have done that to teenagers years ago, and we simply haven't yet. So, when I got home Saturday after my injection and walked back and forth across our dog fence, nothing happened. I didn't get shocked. Everything was fine. So please be confident in the fact that the vaccine is safe. There are no chips in it. There's no genetic altering material in it. It's basically trying to get us to the point where we can return to a degree of normalcy. And although that's a few months off, we are in the early stages of that, and it's very exciting to see that that's rolling out.
Yes, it is.
So we've covered numbers, we've covered testing, we've covered vaccination. What else? What have we missed? We've had a little change in visitation policy because of going red.
Yeah. So we last week turned red on the color coding, and as we had kind of led into that was going to require looking at further reducing traffic in our facilities. So as part of that, our response is within our ancillary areas, such as think of radiology and laboratory coming in, outpatient testing, as well as our medical practices, both in the behavioral health world, Samaritan Center, as well as any Good Samaritan Physician Network practice. There is no visitors allowed. Exceptions are made if somebody needs a caregiver there for medical decision making, and you can work with your provider on how to best do that. Many times that can happen virtually, and we're going to push for that, because decreasing traffic is kind of at the top of the list whenever you turn red of things that we should be looking to do. Because, go back to the very beginning of this segment, we've got sustained transmission, and we know right now that we're talking about exciting things such as the vaccine, but that's not at a point that we can be lax on social distancing or masking. So from a distancing standpoint, if we reduce traffic, helps keep everyone safe. I continue to believe that Good Samaritan is one of the safest places in the region to be in, because our infection prevention practices are well developed, have been for many, many years, and now have just continued to grow with COVID response. But nonetheless, decreasing traffic is important. So in those types of areas, we will be limiting visitation. In the inpatient setting, very few changes, maybe a couple of tweaks with timing of visitation, but we have visitation policy, and as visitors come in and are screened, you'll be informed of what that looks like and what the appropriate visitation will be.
And it's Adam mentioned the virtual visits, and I can rewind an entire year and tell you how not excited I was about virtual visits a year ago. And you quoted an interesting statistic as to what our hope was for 2020 for total number of virtual visits. What was that number we had hoped to hit?
We were hoping to hit 100 virtual visits for the year, as we were starting to move towards digital healthcare.
And where we're at?
And as of last week, we were over 5,000. So looking at glass half full, thank you, COVID, for pushing our virtual care transformation forward much faster than anyone could have ever imagined. And it's here to stay. I mean, we have seen good patient care being able to be delivered through that. Certainly it was a rough few weeks of pivoting to that very quickly, and what's that going to look like and how is it going to happen. But yeah, a strategic initiative for 2020 was 100 visits, and we're over 5,000.
And really the visits that we see falling into that most easily, certainly any mental health type visits, depression, anxiety, which we are seeing tremendous issues with because of what we're all dealing with over the course of the past year. But those visits work really well. Follow-up visits after other major illness work out pretty nicely also, because we want to touch base with people that have been in the hospital, who've recently been ill, and find out how they're doing. Are they eating? Are they drinking okay? Are they recovering well afterwards? Post-operative checks are nice as well. Minor musculoskeletal type injuries, headaches, upper respiratory type symptoms, all of these things are a really nice fit for what we've been delivering as far as virtual care has been concerned. And our patients like it as well. They have been worried. They don't necessarily want to come into the office, and this is an opportunity to touch base, see if this is something that they need additional care, diagnosis, testing, or treatment for, and it makes us feel more comfortable, makes the patients feel more comfortable. And so, as you said, this is certainly something that's here to stay, and although it was somewhat shoved down our throats necessarily at the beginning of the year, it's really a great access to care. We see that also in the case of pediatric patients, that really parents are concerned and need sort of a touch base moment to say, is this something that needs to be evaluated in person? Should we ride this out a little bit more? But it has been fantastic.
And not only, it's not a one-size-fits-all, but it's also not a decision that is made and then you have to stick to that path. I mean, quite often you'll start a virtual visit and then what you're hearing, either you and the patient working together will say, I think you should come in. Yep. We stop the virtual visit and we schedule the appointment and you come in. So it's a great starting point for how we can deliver that care. But it's just really an addition to the care that we provide. It is not a replacement for care or replacement for the relationship that patients have with our providers.
Yeah, sometimes patients just simply have some questions that they'd like to have answered that they're worried about. That gives us an opportunity to see them, see how they are doing physically. Right. And although we can't do all the normal physical exam things, we are able to see how they're doing from a respiratory standpoint. They can get some vitals for us as well. And then most importantly, we get to answer some of those important questions that they may have. Right. So speaking of important questions, Tiffany, what do you have for us for this week? Let's go to the phones or the iPads or the computers.
Lots of vaccine questions.
Of course.
So someone asked, if you have already had COVID, should you get the vaccine or let others who have not had the disease get it ahead of you?
Sure. So one of the recommendations right now in the phase 1A with healthcare workers is that if you have had a positive viral test for COVID in the last 90 days, consider waiting to get the vaccine until you're outside of that 90 days. And the reason for that has nothing to do with the actual individual that's tested positive as much as it does that you likely have some natural immunity, and that we have a number of healthcare workers who have not contracted COVID and are unprotected. So our recommendation at this point has been consider that. It's a consideration. I can tell you that in those 350 plus that have been vaccinated, there have been some vaccinated that have had COVID, a positive test within the last 90 days and are recovered. If you're actively under isolation due to COVID, you cannot be vaccinated. That's a cannot. But if you have recovered, you can be vaccinated. We're just asking from a prioritization standpoint. We want to get the most vulnerable, which would be those completely unprotected, in line first, and then allow others to be vaccinated. With Moderna getting approved, we feel very confident in our allocation. I mentioned the 1,000 doses last week. Today we receive another 1,000, so it's only 2 allocations, but we're feeling good that we are going to continue to get vaccination, because that becomes the other worry. If I wait, will there be vaccine? We can't predict 90 days away what exactly that will look like, but we do anticipate that that's going to be a steady stream of vaccine available here.
Another question is, where do you see people with autoimmune disease fitting into the vaccination schedule?
Now that group is probably going to be in that 1C group that we're looking at. And as we said, a lot of that decision-making process is very fresh. This is just over the last few days or so when the advisory board looks at the highest risk groups and how we continue to deliver health care. That's really what has driven the 1A, and then the frontline workers and first responders 1B, and then this 1C group. So more details will continue to come out over that, but our perception as to where that particular patient with autoimmune diseases on immunosuppression will fall into is likely going to be the 1C group.
And then there's some questions that were submitted to us after we announced the vaccine arrival and that process was getting started. So some people asked about the vaccine itself and how it works. Does it keep a person from getting COVID, and how long would it last?
Sure. So let's start with how it works. The Pfizer and now Moderna that have been approved are the mRNA technology for how the vaccine works. Basically, this technology, it's been kind of hyped as this is new technology. It new in the sense that vaccines have not been produced this way. But this is not new technology. It's been used in cancer treatment for a number of years. I've seen reports of up to a decade that this technology has been used in healthcare settings in treating patients. So just important to understand it's not brand new, never utilized in patient care. How it works is, in essence, the mRNA, when that enters the body, it creates a response where our body recognizes that as coronavirus, even though it is not a live virus and the actual ability to make you sick with COVID is not there. So you can't test positive on a viral PCR or antigen test after getting the vaccine. I've had that question a number of times. What it will produce is a response from your body to produce antibodies. So you will, ideally, that is the goal, in 14 days or so, you would start to test positive for antibodies. And then our immune system is trained, once we see that virus, we create code that says every time I see that I respond. So it doesn't, this type of vaccine, and there are many other vaccines like this, does not prevent you from becoming infected. What it does is it creates an immediate response from your body that will allow your body to respond before the virus grows to a point that you get sick, become ill, and ideally will keep you from having any side effects, and then you fight off the virus. And what is still remains to be seen is the last piece of that: how long will it last? We simply don't know. I would love to be sitting here saying this is you're going to get these 2 shots and coronavirus is gone, but we just simply don't know what the immunity length will be. Is this going to be an annual type of vaccine? Is it going to continue to be something that is worked through, and there will be another, a second vaccine at some point that then will give us, long-term immunity forever? We don't have those answers, but we do know that it does give us immunity for a period of time, and that's the path that we're going down.
And this is what's considered active immunization, which is what most of the vaccines are classified into. Passive immunization is when we're giving people the antibodies, as we are doing with the monoclonal antibody infusion. But the thing to keep in mind is what Adam said is with our previous vaccines, Haemophilus influenza B, polio virus vaccine, shingles vaccine, all of these others are just of a different technology. Some of those were live attenuated, some of those were live killed. But the idea is to introduce something so our body is prepared the next time that it sees that. And this technology, as Adam said, has been around for a while. It's being applied to the vaccine in such a way that we're being given a testing where our body says, okay, this is what we need to be prepared for when we're exposed to it, and then we respond quickly. Our natural immunization, or our natural immunity within our body, basically works that way and works relatively quickly. It's just this gives it a bit of a head start.
Looks like that's all the questions today.
Fantastic. Well, please, everybody be cautious around the holidays. Think through your plans as to how you're going to be getting together with your family, your friends, over the course of the next couple weeks or so. We've got a double header here. We've got Christmas, and then we've got New Year's coming up. There will be important things that will be discussed in between those 2 holidays with regards to schools and returning to school and what that's going to look like. So please be thoughtful of your family, your friends, your kids, and our community as we go into these next couple weeks. And everybody have a great holiday season. Thank you.